I'm Dr. Streicher. Your question is, does laser work to treat vaginal dryness and painful sex? I'm going to give you the inside information. The answer is yes. Not only can you laser your face smooth, laser your pubic hair away, and laser off regrettable tattoos, now you can also laser your vagina to treat vaginal dryness. So here's what you need to know. Carbon dioxide, or CO2 lasers, are FDA-cleared medical devices that deliver energy to the surface of the vaginal tissue to stimulate your own cells to make more collagen, more fibrin, and increase blood supply. The laser beam penetrates the vaginal tissue just a few millimeters, basically the depth of a credit card. So the vaginal wall is essentially resurfaced with restoration of lubrication and elasticity that's vanished as a consequence of menopause, surgery, or maybe cancer treatments. And like the prescription options, laser does treat other symptoms of genital urinary syndrome of menopause, like vulvar vaginal itching, urinary urgency, and of course, painful intercourse. Early data suggests that the laser may also help reduce or eliminate recurrent urinary tract infections. So one of the major advantages of laser treatments, other than the convenience of not having to do something on a regular basis, is that the laser is not only used to treat the entire vaginal canal internally, but also treats the opening of the vagina. So the laser treatment involves 3 5-minute sessions that are generally performed in a doctor's office, usually about 6 weeks apart. No anesthesia is required other than I do apply a local anesthesia cream to the opening of the vagina. There is no pain. My patients report that they feel only a gentle vibration when the laser probe is in the vagina. 94% of women in clinical trials report that after the treatment, they have significantly less dryness, less pain and irritation, and a dramatic improvement in sexual pleasure. These results generally last around a year, so that means that an annual booster treatment is recommended. And vaginal laser treatment, it's been around for a long time, and it's been used both here and in Europe in hundreds of thousands of women. And I've personally treated hundreds of women in my laser program with really good results. Here's the downside. The main downside is that medical CO2 laser treatments are expensive and they're not covered by insurance. One of my patients told me the choice was between pleasurable sex for a year or a vacation in Florida for a week. She chose the sex for a year. A few things to be aware of. CO2 laser therapy is not the same thing as radiofrequency, which is a completely different treatment that sometimes claims to help genital urinary syndrome of menopause and vaginal dryness, but there's been no research to confirm that that's the case. And whatever you do not have this procedure performed by a plastic surgeon or a dermatologist. I mean, think about it. Would you have your gynecologist do your facelift? I don't think so. And while it's not a difficult procedure to perform, only gynecologists have the expertise to evaluate the vaginal and vulvar tissue and to determine the cause of your pain. Sometimes pain during intercourse has nothing to do with vaginal dryness, so it won't be helped by a laser treatment. The other problem is that often non-gynecologists, they just treat the vaginal canal and not the opening of the vagina. And it doesn't matter how nice the room is if you can't get through the door. So tell your plastic surgeon to stick to your wrinkly face and leave it to your gynecologist to restore wrinkles to your vaginal walls. For more information, check out my book, Sex RX, and also my other videos and articles, which can be found on drstreicher.com.